Anger associated with violence is not nearly as well studied as aggression associated with violence. It is truly puzzling how researchers ignore anger as a separate construct, or appear to assume it is part of or the same as aggression. While anger may be a part of many aggressive acts and crimes, it's not a person's feelings that batter, rape, or murder another. Long-term held in anger, often becoming resentment, has been noted in many murderers, especially those whose long-term intense resentment is about being abused or shamed. Enduring rage often leads to displaced aggression, where a third party, not the person who caused the real pain, ends up as the victim. The third party may be the last of a long line of persons perceived to have given slight or insult to the aggressor. Sexual assault is a pernicious crime, and research on what drives assailants' actions is mixed. Some believe the crime is sexually motivated, while others believe its motivations have some basis in anger. The use of sex to express anger has long historical bases. Some research shows that assailants were not lacking in sexual outlets, and in many cases aggressed for other motives, namely anger and power. This would make sense where an assailant's sexual advances are rebuffed and their ego diminished and bruised, leaving them with a perceived motive to restore their ego and retaliate for the perceived insult. Research also has shown that assailants may also be persons with high trait anger or very insecure attachment styles, and in some cases, the motive was clearly revenge. In many cases, there are clear indicia of narcissism in the assailants. Not surprisingly, in studies of aggressors who perpetrated domestic violence, they consistently reported higher levels of anger and hostility than nonviolent men. Unfortunately, researchers have a poor record of assessing anger measures in their studies of such perpetrators. In turn, this may explain the limited success of programs designed to address aggression in domestic violence. Like other perpetrators of intimate violence, those committing domestic violence appear to have high trait angers and lower than normal scores in problem solving. Just as there is no one-size-fits-all category to describe persons who commit intimate violence, there is no single theory to explain it, or upon which to base more effective treatments for offenders. Group anger, or anger expressed en masse, such as large-scale violent conflicts that do not necessarily rise to the category of a declared war, are sadly all too common today. Researchers Roy and Judy Idelson focus on such conflicts, and they've theorized that there are 5 attitudes of which any one can contribute to aggression and violence, but when any are combined, greatly increase its likelihood. They call these the 5 dangerous ideas. The first dangerous idea is superiority as a means of justifying violence against the people or in order to gain their resources. The second dangerous idea is that the aggressors have somehow been denied justice or received unfair treatment. In some cases, this is true. However, it is the aggressors' dwelling on and use of the fact to justify violence that is problematic. Moreover, they often have little self-assessment or self-acknowledgement of responsibility for their situations, and there's greater focus on the unfair treatment received from others. The third dangerous idea is an unwarranted sense of vulnerability. Exaggerated perceptions of threats often lead to anxiety, which can precipitate fear, anger, and aggression. The fourth dangerous idea is distrust or suspicion, with or without factual basis. Attributing hostile intentions to others leads people to assume an us versus them, or a with us or against us mentality, with no middle ground for understanding or compromise. The fifth dangerous idea is helplessness. When people feel they have no recourse, no help coming, and no means to negotiate for a better position, aggression may appear a reasonable option. The combination of any of these dangerous ideas can spark aggression faster and even lead to large-scale aggression founded upon hate. War is usually considered instrumental aggression, and there is disagreement about anger's role in warfare. Some believe that the soldier's effectiveness is enhanced by their adoption of anger and even hatred toward an enemy, while others, usually possessing greater tactical understanding of warfare, view anger as a potential distraction from effective tactics. Angry soldiers may act impulsively and inhibit planned maneuvers and strategies. We cannot have angry tank drivers coursing around every which way on the battlefield and expect a tactical maneuver to be executed properly. These ideas are as old as when they were debated by the Roman philosophers Seneca and Aristotle. Finally, we cannot ignore that both familial and social bonds and norms sometimes sanction aggression. Examples include gypsy clan raids against other gypsy clan encampments, entire villages attacking neighboring villages over any manner of differences, and honor killings and revenge that can lead to generational feuds such as the notorious Hatfields and McCoys along the Kentucky-West Virginia border. The decades-long anger and aggression in that case was over, allegedly, multiple thefts, romantic indiscretions outside of socially approved norms, and then murders and revenge. The upshot of anger as a mediator of aggression is that anger, left untreated, is quite likely to result in a relapse of aggression.